Hey everybody, today we're going to look at a couple different techniques for improving ankle mobility, especially in the talar curl joint. I have one of my coworkers, Shane Zaineth here. He is going to show us how to use these techniques since he's actually the one that taught me. But to begin first, I'm just going to show my starting range of motion. So right about there is when my heel starts to come up. Okay. Shane, go ahead.
Alright, so what we're going to be doing, a subtalar and a talar curl joint distraction. I guess I'll do this off of your left leg here. So basically, you need to use two of these TheraBands, or TheraCords, and we will have to look up the diameter a little later, or the measurements with it later, because you do have to use the right length with it overall, or otherwise if it's too wide, you won't get the same traction with it. So basically it does take a while to set up. That's one of the downfalls of it, but basically I always use a towel too, just because if someone has like leg hair like Chris, or just in general, it can be uncomfortable with the bands. So if you just wrap the towel tight, and then you're going to bring one band along the lateral plantar surface, and you're going to bring this band over the top, and you're going to loop it through, and you basically want to wrap it as tight as you can too. So I always sit on a stool and then just pull these bands through. And this is the tricky part about it, is that you actually need one of these bands that are underneath the plantar surface. The bands that go underneath the plantar surface, you have to loop one of them behind the heel, behind the calcaneus there. Then you just continue to loop that through. So you just continue to fish that through. And it usually takes at least a few tries with this setup to get a proper technique with it. Then you're going to take the second band. The second band is going to go along the medial plantar surface, and you're going to do the same thing. You're going to loop that over the top here. You just want to fish that tight again. And you're going to wind up with it the same as the first one, where you're going to have to wrap one of those bands underneath, or behind the calcaneus rather. So for the sake of time, I'm just going to pull that pretty tight there, and that's actually pretty good right there. Again, if you set it up overall, it takes a few times to learn that traction overall. So, you feel like it's pretty good traction there?
Yeah, just the setup by itself provides some traction.
Okay, exactly. And then I usually have, if you have a table like this, I'll have someone block with that. So we'll go through a few moves with motion actually. So I'll actually give some distraction here. So I'll give some pretty good resistance on the bands, and then I'll have them go through a few different motions. So I'll have you start off with 20 pumps into dorsiflexion and plantar flexion. And we don't have to go through all of that.
Go through 10 each.
Yeah. So if you go through, and you can obviously get feedback from your patient as well, asking them as far as, if that's comfortable, if they need to adjust that at all, because again, it can get uncomfortable if they have like leg hair, or just if the towel's not set right. And then also have them go into inversion and eversion. Oh yeah, you actually want to do a retest too with this one?
Yeah. Now what's nice about doing all the different motions is that it helps to mobilize the different parts of the capsule, so that you get like the distraction at the most restricted area.
Exactly. And then you're going to do 10 circles both clockwise and counterclockwise. And then I usually give, at the end, I'll usually like do a distraction and do like a few quick thrusts with it. Alright. And then you can unhook that. I didn't have the towel set up optimally there, but get the point.
Yeah, you did the job.
Alright.
So we'll retest. Right about there now is where my heel's starting to come up. So it's another couple inches, and then you would couple that with a couple other techniques as well. Shane's going to show us one other to improve tailor curl mobility.
So this other technique is actually a leverage technique. So you have someone go prone. It just depends on the length of their leg in relation to your forearms, but you're basically going to be holding around the talus and posterior calcaneus, and then it's a leverage technique. So you can actually just by putting the knee into further flexion, you're actually going to start to get some distraction out of that. And so you can also stack up either, you can fold a pillow in half to do this technique. You can also use several towels for it, but it's a really effective technique for getting that distraction if you're having trouble getting distraction with just mobs based off of the table. Especially if you're a smaller person overall and you're working on a bigger person, you can really use this leverage technique by just getting that knee flexion. You can really get a lot of traction with it. So it's a pretty effective technique.
Thanks, Shane.
Yep.